Let's make sure.
Hey guys, we're going to get started in just a minute. We want to make sure that everyone gets one of these flyers because we're giving you guys all a complimentary week of cryotherapy or your choice of a complimentary B-shot. So Vanessa's giving out the flyers on that side, Michael's giving out the flyers on this side. Make sure you guys all get one. And just out of curiosity, how many people actually have sleep problems? Wow, all right. We're going to try to solve those today.
Your choice. And we have Super B, Longevity, Brain B, Lean B. Yeah, they all B complex. Yeah, like Beauty B has, what's that? Yeah, the Super B. I'm saying they're all, we have like 5 different ones you can choose from. Yeah. How are you?
Reading your share versus the rest of it. And I was trying to see, I'm like, are you dermatologist? Thank you.
I think there's one more seat there if anyone wants it. Yeah, in there. Hey, Andrew. How are you? One more chair. Perfect.
No, we're just getting started. So. Welcome everyone. Welcome everyone to Next Health. I'm Dr. Darshan Shah. I'm the CEO and co-founder of Next Health, and I really appreciate everyone coming for this amazing talk on sleep that we're going to have today. So before we get started, before I introduce Dr. Breus here, my good friend Dr. Breus, I want to tell you a little bit about Next Health and who we are, because I see a lot of new faces here, and so you probably don't know what Next Health even really is. And so what we always say is Next Health is a health optimization center. And what our goal is, we're a medical facility, it's under my medical license, but we don't treat disease here. It's not like going to a hospital or going to see a doctor when maybe you sprain your ankle or something like that. What we do is we want to keep you healthy for a long, long time, possibly forever, so you never need to go see a doctor for a disease state. And we do that with multiple different treatment modalities. We use IV therapy, cryotherapy, sauna, heat therapy, but what we also do is we do a lot of incredible blood testing here, stuff that your normal doctor doesn't necessarily do. We do things like food sensitivity tests, micronutrient tests, telomere tests, genetic testing. And this is all stuff that you might have heard of at some point in time, but you don't really know where to take advantage of it. And even if you were to get the test done, you might not know really how to read the results or what the results mean. We have a medical team here of Megan, our nurse practitioner, myself, and a few other practitioners here that will go over the results with you and guide your health optimization journey. And I know there's like tons of conflicting evidence out there. Seems like everyone is a health and wellness expert nowadays, and they write blogs about things. One day you're supposed to eat meat and one day you're not. One day you're supposed to take omegas, one day you're not. It's crazy out there. And we are here to cut through all that craziness for you and really tell you what's real, what's vetted, and what will work, and what's going to work for you, because each and every one of us is an individual, and our biologies are all different. Your biology is different than your biology, different than your biology, and we need to optimize your health plan for you. And that's what we do at Next Health. It's a totally new type of business. We love telling our story because we're having a lot of fun doing this, and it's a fun environment here, so hopefully it's welcoming and you feel like this is a great place to come maybe once a week or maybe every other week to go along this health optimization journey and, like I said, hopefully never end up at a doctor in the first place. So that's who we are. We, I think everyone should have got a certificate by now, right? To give you a sample over the next week of what Next Health does. So we'd love to see you here and kind of show you what we're all about and give you some more in-depth of a tour of Next Health. And also, we are doing a social media raffle today. So if you take a picture of Dr. Breus over here and you post it on your Instagram and tag Next Health or your Facebook or your Twitter or whatever it might be, and tag Next Health and tag Dr. Breus, we will pick one of you tomorrow to win one of our treatments in IV therapy to try out as well. So please do that. And without any further ado, I'd like to introduce my good friend, Dr. Breus. Dr. Breus is one of the world's foremost experts on sleep. You might have seen him on Dr. Oz, you might have seen him on The Doctor Show, or you might have seen him on TV in hundreds of different episodes of shows that he's been on. He's written 2 books? 3 books on sleep, all of them, and they're not just on sleep, they're really about life and how to live a better life. And I love reading his books because they go from sleep into relationships, and they go into how to live a better life with your wife and sex and all the things that go around sleep that you might not have thought of. Dr. Breus, not only is he accomplished in the field and he's very well known, but he's also an incredible speaker. And he speaks a little fast like I do, but you will get a ton of good information today that you've never probably heard of before. So without any further ado, I'm going to welcome Dr. Breus and give you the...
Thank you. Thank you very much. So, first of all, I have no problems with people if they want to ask questions in the middle and you've got something that you want to ask, that's fine. If you want to wait till the end, we're going to have a big Q&A at the end as well. No subject is off limits during Q&A except I don't do dream interpretation, okay? I have to say that before every time because one time I was giving a lecture, there were about 1,000 people in the audience, and somebody stood up and said, I was naked with my 3rd grade teacher. Like, there's 12-step programs for that. You don't have to worry about that here. But we're gonna open it up for lots and lots of questions, but what I thought I would start off with first is there aren't gonna be any slides. I've got my computer up here to remind me of a couple things that I wanna speak about, but just listen in. If you wanna record it, that's perfectly fine. I know we're streaming on social media here as well, so definitely do the social media thing. And also, just to be fully transparent, I am not just a doctor here, but I am a patient as well. So Megan is my nurse practitioner. She takes good care of me, as does Dr. Shah. So I don't just work here or speak here or things like that, but I actually really take this stuff pretty seriously because I think it's pretty revolutionary. So with that, I'm gonna launch into talking to you guys a little bit about sleep. So first of all, I want to explain to you what sleep is in the brain and how it works to give you kind of the vocabulary, because some of the things I'm going to talk about a little bit later are going to require you to know things like REM sleep and delta sleep and sleep cycles and stages and things like that. So first of all, it turns out that in the brain, there are 2 distinct systems for sleep. One is a drive and the other is a rhythm. So drive is a lot like hunger, right? So I'm hungry, I eat something and that hunger begins to dissipate, right? The same holds true with sleep. So when a cell eats a piece of glucose, something comes out the back end. One of those things is this stuff called adenosine. Adenosine works its way through your system and it goes to a very specific receptor site in your brain just for adenosine. And as it gets more and more adenosine in your brain, you get sleepier and sleepier and sleepier, okay? Now, I'm kind of a geek, and so when I looked at the molecular structure of adenosine, one of the things I realized is it's 1 molecule off the molecular structure of caffeine. Aha! Okay, so pretty interesting, right? So I'm gonna teach you a hack in a little while where you use caffeine to help you sleep. What? what is this guy talking about? Don't worry, we're going to get there. All right? So first of all, I digressed a little bit. So there's this drive based on adenosine buildup, and that's one system. That's what helps you fall asleep. But there's a second system called your circadian rhythm. Your circadian rhythm is a biological clock that works inside. So you ever notice how you kind of get hungry at breakfast time, around lunchtime, and around dinner time? Right? That's your circadian rhythm for hunger. You actually have a circadian rhythm for sleep. It follows your core body temperature rhythm. So when you're too hot or too cold, it's extremely difficult to fall asleep, but your body follows this curve. When your rhythm is working right and your drive is high, you sleep. It's pretty straightforward. But if your rhythm is off or your drive is off, you don't. So Michael, when on earth would I have a situation where my rhythm and my drive might be off? Like, how could that be? I guarantee you, every single person in this room has had this situation occur. How many people have ever had a situation where you were out on the weekend and you did something more physically exertive than you ever usually do? Maybe you went mountain biking or hiking, or maybe it was just walking around, and you come home and you're exhausted. I mean, dog tired, right? And so what do? You say, you know what? I don't have any plans for tonight. I'm gonna get in bed early, and I'm gonna catch up on all the sleep that I've been missing, right? And I'm just gonna slide in there, it's gonna be fantastic, right? And you get in bed, you get in your pajamas, you get in bed, and what happens? Nothing. How many people by raise of hands have had this happen to them? I would imagine almost everybody. So that's where your sleep drive is incredibly high, but your rhythm is off because what? You got into bed at 8 o'clock at night, right? And your brain doesn't want to go to bed until 10 o'clock in the evening. So that's kind of an example of sort of how these things have a tendency to work, right? So you've all experienced this before. So the goal here is to have people going to bed at the same time and waking up at the same time, and have them be sleepy enough to be able to fall asleep right when they need to. And that's how those two systems work together. Now, you've probably heard people talk quite a bit about things like sleep stages or sleep cycles. So let me define that just a little bit for you as well. So one of the things that we know is that when we enter into sleep in stage 1, which is super light sleep. And as a matter of fact, if I wake you up during stage 1, you'd tell me that you weren't asleep. But I could tell that you were asleep because your EEG waveforms, your brain waves, would be letting me know that you're asleep. Then you go into stage 2, then you go into stage 3 and 4, back to stage 2, on into REM sleep, and that's a full cycle. That whole unit, or dance if you will, and it's very particular, you actually have to go exactly in that order most of the time. That whole thing takes approximately 90 minutes or so. And you have 5 of those across the night, okay? Those numbers, by the way, 90 minutes and 5, are gonna be important in just a second, all right? So just keep those kind of locked in your head. Right, so, all right, so Michael, you've got your sleep stages, but why is that so interesting, and what's so informative about that? It turns out that the amounts of different stages of sleep are different at different parts of the evening. So in the beginning first third of the night, you have more what's called delta or deep sleep. That's stage 3 and 4 sleep. Why is that important? That's the physically restorative sleep, right? That's the wake up and feel great sleep. Right? That's when your body emits the most growth hormone. And that's kind of like when you bring your car into the body shop and it pulls out the dings and the scratches and the dents. That's kind of what's going on in the first third of the night with this deep delta sleep. Okay? Now, many of you are sitting here thinking, man, I'd like some deep delta sleep, right? I go to bed and I don't feel like I get any of that stuff, right? Don't worry, we're gonna help you work on that as well. The last third of the night has something else. It has more REM sleep, right? So for the folks in here who are at least as old as me, you know that there used to be a band, there still is a band called REM. For most of the other people in here, they're like, what is he talking about, right? I went to school at University of Georgia in Athens, which is where REM is actually from. So I got to see them play live, which was pretty amazing. But what happens during REM sleep is the mental restoration, okay? What do you mean by mental restoration, Michael? Well, it's actually really interesting. This is where our memory comes into play. When we hit REM sleep, we are able to move information from our short-term memory to our long-term memory. And by doing that, we create an organizational substructure inside of our brain to deposit information. Why would we want to do that? So we can answer questions, so we can make decisions, so we can retrieve that information later on. But when those two pieces of information lie down right next to each other, they actually have to connect, and they connect with a very small electrical impulse in our brain. we actually think that the making of that electrical impulse is why we dream. Kind of interesting, right? Now, how, Michael, does that explain why in my dream last night I walked into my kitchen and my third grade teacher was there eating a bowl of spaghetti, you know, with my dog, right? Well, because that piece of information may have landed in a spot that it connected to for whatever reason. Your brain makes these connections. Consciously, we don't necessarily know how or why our brain makes these connections, but they do. So mental restoration happens at the back half of the night. Physical restoration happens at the front half of the night, right? So that part's critically important. Now, what were those numbers that I told you about? How long is an average sleep cycle? 90 minutes. And how many do people usually have? Okay, so here's what we're going to now do is I'm going to teach everybody what time they need to go to bed. Okay? So I created this thing called the bedtime calculator. It's actually kind of cool. So everybody in here has a socially determined wake-up time. What do I mean by that? If you've got kids, what time do they have to be up for school? If you don't have kids, but you got to go to work, what time do you have to be up for work? 5 days a week, you're probably getting up at roughly the same time, right? So by a raise of hands, how many people in here are getting up at 7 o'clock? Raise your hands. 6:30? 6? 5:30? Well, you don't count. 5 o'clock? He's a friend of mine. Oh, in the back. Oh, you must have a long commute, right? So we're going to talk about this in a minute, but these are people who get up that early. We know them as early birds. They actually have a different set of genetic makeup that makes them get up earlier in the morning. Okay, so we know that the average cycle is roughly 90 minutes, and the average person has 5 of these cycles. So 5 times 90 is, come on, 450, thank you. Phew, I wasn't sure if we were going to get through that. Nobody said there was going to be math, right? 450 minutes in an evening, okay? If we divide that number by 60 to just figure out how many hours, that's 7.5 hours. So right out of the gates, 8 hours is a myth. 8 hours is a myth. I just want to be super clear that every single person in here heard me say that, okay? How much do I sleep? People always ask, Dr. Breus, how much do you sleep? I sleep 6.5 hours a night. I have almost my entire adult life. I cannot go to bed before midnight. I'm a night owl. So you know, like the teenagers who want to stay up until 12, 1 o'clock, that's me. I just never left being a teenager, apparently, right? So that's it becomes really important, right? So take a look at your normal wake-up time. So let's make the math simple, right? Let's say use 6:30, the time that I wake up. If you count back 7.5 hours, that is 11 o'clock. So that becomes your bedtime. But wait a second, Dr. Breus, you said you only sleep 6.5 hours and you just counted back 7.5 hours. How did that work? So I did this experiment on myself. I went to bed at 11, I woke up at 5:30. I went to bed at 11, I woke up at 5:30. Okay? I tell people all the time, the only thing I hate more than mornings are morning people. All right? I have no interest in being up at 5 o'clock in the morning. My jokes are doing reasonably well on this one. I like it. I like this group. We're going to keep you guys. So here's what I did was I realized that my sleep cycle was actually 82 minutes long. How did I know that? I work in a sleep lab, okay? So I can test my sleep cycle. You can actually do it too with the trackers. There's a lot of trackers on the market now. You can actually figure out how long your sleep cycle is and then start to count backwards and figure out what your bedtime is. But it's easier if you just take your wake-up time, roll it back by 7.5 hours, right? And then see what happens. If you're waking up within 5 minutes of your alarm going off, you figured it out. I haven't used an alarm in almost 20 years, okay? Now, I'm not saying that if I have an early morning flight that I don't set an alarm for something like that, because I do that, of course, right? But just generally speaking, I go to bed when I get tired and I wake up when I don't. The consistency we've discovered is what allows me to get less and less sleep, right? Sleeping only 6.5 hours is because I literally go to bed at midnight every night and I literally wake up at roughly 6:30 every morning. And that's how it works for me. But all of you can run this experiment starting today or tonight and be able to figure out roughly how much time you should be sleeping. Now, I kind of didn't ask the question about wake up. How many people in here use an alarm to wake up? All right, so keep your hands raised. How many people who have their alarm hit the snooze button? Go on, keep your hands raised if you hit the snooze button. All right, keep your hands raised if you hit it more than twice, more than 3 times, more than 4 times, more than 5 times. Look at these two right here. More than 6 times. You don't know, maybe? Okay, so the snooze button was the single worst invention for all of sleep. Okay? For everything, and I'll tell you why. The average snooze button is somewhere between 7 and 9 minutes long, and your body can't physically get back into deep sleep or in REM sleep. So remember what you're doing most of in the last third of the night? You're having REM sleep, which is your memory sleep, which is your mentally restorative sleep. So what are you doing by hitting that alarm 2, 3, 4, 5, 6 times? All you're doing is getting yourself more tired. Exactly, just light, crappy sleep. So do yourself a favor, set your alarm for the last time that you can wake up. Or if you're a night person like me, if you're more of a night person and you need at least 1 snooze, I'm gonna give you 1. But 1's the limit. Okay, I don't want you to have any more than 1 snooze. But now you also know what time to go to bed and what time to wake up, so you shouldn't actually require the snooze button anytime soon. We also know that, yes, question?
So how long should a snooze be if it's not 7 or 9 minutes?
So the truth of the matter is that a snooze should actually it would take you from waking up out of REM sleep to get back into REM sleep, it would probably take you closer to between probably 15 and 20 minutes. So if you have the ability to change the snooze button or the length of snooze, 20 minutes would probably be my recommendation, but I wouldn't do more than 1. Or set 2 alarms, like some alarm clocks have 2 alarms. How many people have to have the alarm clock put across the room in order for them to wake up and get out of bed? Yeah, I do the same thing, don't feel bad. I don't use an alarm, but when I have to for a flight or something, I put it across the room because if I don't get out of bed, I'm done, right? I just have to kind of psh and go. All right, makes sense. So first of all, what does sleep affect from a health perspective? We're in this amazing place and we're learning a lot about preventative health and things like that. So let's talk for just a second about weight and weight loss. So weight and weight loss has been something that lots of people struggle with for different reasons. But most people don't understand how sleep dramatically affects your ability to lose weight. So I'm going to explain to you exactly what happens metabolically speaking. So my second book was called The Sleep Doctor's Diet, Lose Weight Through Better Sleep. And it's all about how this relationship exists between sleep and the metabolic process. So first of all, here's one of the things that we know is when you're sleep deprived, your metabolism slows down. Why does it do that? It's trying to conserve the resources, right? The fuel that's left in your body. It doesn't want to use it all up because it doesn't really know why, but for some reason you're still awake and you need more fuel, so it slows the metabolism down. The second thing it does is it raises your cortisol, which raises your appetite. Why does it raise your appetite? Because it wants more food, right? Your brain is telling you, hey, you're up, and I don't know why you're up, but we're going to slow your metabolism down. We're going to make you go get something to eat because we want to get more resources again into the system. Hormonally, it kind of does a number on you as well. There are 2 hormones, leptin and ghrelin. Ghrelin is the go hormone, and it makes you hungry. By the way, there's a difference neurochemically between hunger and appetite. And so ghrelin actually feeds hunger. So you have 20% more ghrelin. And leptin is the thing that makes you feel full. And you have 15% less leptin. So just stick with me for a second here. So when you're sleep deprived, which by the way is different for all of you, right? Because you now know what time to go to bed, so you can figure out how much sleep you need. So if you lose an hour to an hour and a half of the sleep that you need, this is what's going to happen to your body. Your cortisol is going to be raised, so you're going to have high appetite. Your ghrelin is going to be enhanced, and so you're going to have high hunger. Your leptin is going to be lower, so you won't know when you get full, and your metabolism slows down. If this is not a recipe for weight gain, I don't know what is, right? Every single time you do any type of diet, whether it's a diet to lose weight or it's just you're trying to eat healthier, if you want your body to get all of the advantages from it, you've got to get good sleep. There's another little known fact. How many people in here, when they're super tired, what's the food that you reach for? Carbs, greasy food, sugar, right? All of that stuff. It's delicious, right? It's so good, especially when you're tired. So a great study at the University of Chicago showed that people actually, when given a preference, if they had a table full of healthy choices on one side and a table full of cakes and cookies and pies on the other side, when sleep deprived, will go straight for the cakes and cookies and the pies. And there's actually a neurochemical reason why this occurs. So it turns out that those cakes and cookies and pies actually elevate serotonin. And that helps relax that cortisol and make you feel more comfortable again. So your body is telling you to eat the fattening stuff the more sleep deprived you are, right? So it's really easy. Get good sleep. If you can get some good sleep, you'll definitely have a much better success at the diet. Do you have a question? How about a very good quality of dark chocolate? So my wife eats chocolate every single day. And she told me if I ever got on stage and forbid people from eating chocolate, that we would be divorced. And I've been married for 19 years and I'm planning on staying there. So I am not telling anybody to get rid of good dark chocolate. The truth of the matter is chocolate doesn't have a tremendous amount of caffeine. So, and dark chocolate especially, it doesn't have a tremendous amount of sugar, so there's nothing wrong with chocolate. You heard it here from the sleep doctor, there's nothing wrong with chocolate. I'll get your question in a second. But I will tell you a funny story. So what's that? Dark chocolate is certainly better for you than milk chocolate, but I like it all. I mean, I'm not a big chocolate person, but my wife, she can eat a bag of Kisses like it's unbelievable. You don't want to do that, right? But it's okay to have a couple of pieces of chocolate. So I never thought that people would eat chocolate in bed, right? But I was wrong. So I had a sleep lab when I started my practice in Atlanta, actually in Decatur, Georgia. And this woman came in, she said, I can't sleep, it's terrible. I don't know what's going on. We're like, all right, let's do a sleep study. So we bring her in to do the sleep study, and we had a camera on her, and I happened to be in the lab that night, and the sheet went up like this in front of her face, and she came down, and she was doing this. And she was like chewing, right? And I was looking at because I've got this little camera, and I'm like, what is she doing? And so I sent the tech in. She had one of those 3-pound Hershey bars. You know the kind you get for Christmas, right? And she was just gnawing on it at night. I was like, I think I found your problem, right? So that you can't do. But a square or two of dark chocolate, there's nothing wrong with that, absolutely. But sleep actually affects everything, not just your metabolism, but it also affects pain. So if anybody in here has got any pain syndromes or is recovering from, I forgot, you had a question. What was your question?
Don't you also crave carbs when you're sleep deprived? It's just faster and slower, fast-burning carbs, it's just a sugar for an energy rush.
So let me just see if I understand the question. So don't you burn carbs faster when you're sleep deprived? Is that the question?
You crave carbs.
Yes.
It's just a quick.
Well, so you crave them because you're thinking that it's quick energy, but your brain actually wants them for the serotonin to make it calm down. So it's actually both at the same time. So that's correct. So also it affects pain. So great study out of the University of Chicago, again, looking at college students, and they did something called the cold pressor test. So this was fascinating. So they took a bucket of drywall, like the big buckets of the stuff, the drywall mud, they emptied it out and they filled it with ice water. And they measured the temperature, and it was freezing cold, okay? And they took college students, because that's the only people who would volunteer for this experiment, right? And they said, here's what we want you to do. We want you to take both of your feet and dunk them in, and we're gonna time you to see how long you can keep your feet in this ice cold water, okay? And it was incredibly painful, but does no actual tissue damage, right? So they would time them. Then they said, here's what we want you to do next. We want you to stay up for 24 hours. And then when they brought up the same bucket, same temperature, same kids, they pulled their feet out half as fast. The pain hurt twice as much by their report, and the only difference was 24 hours of sleep deprivation. Pain hurts worse the more sleep deprived you are. That's interesting, right? That's fascinating to me, right? Recent studies came out about cancer. Cancer cells multiply faster the more sleep deprived you are. Period, end of story. The data is incredibly consistent, right? All disease gets worse when you are sleep deprived. It doesn't matter what it is. It all doesn't function. Your body just doesn't fight off infection well without sleep, right? All of the things that you do during the day all get worse if you don't get good sleep. As I always like to say to people, everything you do better with a good night's rest. Question?
What's the process behind, what is the body doing when you're sleep deprived and then you're trying to, or you're inflicting pain? What's going on?
So what's going on in your brain when you're seeing when you're getting a pain signal when you're sleep deprived?
Yeah.
So we're going to get a little bit into the weeds here, but basically what we're seeing is that, when we're talking about pain, there's physical pain and then there's the perception of pain called nociception. Nociception happens much faster. So you actually think the stimulus is much worse than it actually is when you're sleep deprived, right? So think about, for example, if you like to work out, right, and you're sore, You don't like to work out so much. If you're sore and sleep deprived, do you go to the gym? No way, right? So it has a lot to do with exercise adherence. It has a lot, because your brain doesn't want to do that, right? Because of all these different things that are going on. Yes? Nociception. Nociception, I think, but I'm not a great speller. Just to let you know. Nociception. I'll talk to you about it afterwards if you want. So, who in here likes to nap? I'm a big napper. I love napping. I think napping is one of the best things you can possibly do. If you don't get enough sleep, it's not a bad idea to nap. But would you believe me if I told you that napping during certain times of the day will actually produce different results? So there was a great study, Dr. Sarah Mednick, she wrote an entire book called Take a Nap, and it's amazing, right? And so what she discovered was if you nap in the morning hours, you actually become more creative. If you nap in the early afternoon, you can become more alert. And if you nap in the later afternoon, you can actually do detail work much better all of a sudden.
Can you say it again?
Napping in the morning, you're more creative. In the early afternoon, you become more alert. And in the later part of the day, you become more detail-oriented, right? And you can focus on things differently. Now, I remember I was talking to you about caffeine, and I said there might be a way that you could actually use caffeine to help you sleep, right? I said that earlier, didn't I? Right? And people were like, Michael, what are you talking about? So I'm going to give everybody my favorite hack. I call it the Napa Latte, okay? So let's say that you didn't get a great night's sleep the night before, right? And by the way, don't do this every night, or day rather. But if you didn't get a good night's sleep, let's say you only got 4 hours and you're just dragging it and you got to give a presentation or talk to your boss or drive somewhere or whatever it is that you have to do. What are you going to do? Go out and get a cup of drip black coffee. It has about 110 milligrams of caffeine in it. Put in 3 ice cubes just to cool it down. Okay? Drink the whole thing as quick as you can. Close your eyes immediately and take a 25-minute nap. Why 25 minutes, Michael? 25 minutes is about the time before you get into deep sleep. Anybody in here taken a nap and felt worse? Not better? It's because you napped too long. You really want to keep your naps to about either 25 minutes or a full sleep cycle, which would be 90 minutes. But in the Napa Latte, slug the coffee, 25-minute nap. Here's what happens. During the nap, your brain eats up the adenosine, and the caffeine's just waiting. And it slips perfectly into the receptor site. You're good for 4 hours, guaranteed. It's a lifesaver. Don't do it every day, please, because it's not the healthiest thing in the world to do, but it's certainly not a bad thing to do when you're in a pinch, right? But napping for 25 minutes or less is actually a great way to really be able to boost yourself, especially if, let's say, you work a night shift job and then you go to school during the day and you just don't have a lot of time to sleep. Napping is a great way to catch up on sleep. Yes?
I've heard a lot that napping can affect
Your circadian rhythm? It can. So a perfect example, like remember how we used that example before of when we got in bed and we were super tired and our brain couldn't fall asleep? The same thing can happen if you nap too close to bedtime. And by the way, napping is terrible for people with insomnia. Terrible. Why? Because we want people with insomnia to be sleep deprived before they get in bed because it helps them fall asleep. We don't want them to have taken a nap earlier because then they don't have enough sleep drive, right, to push them through and allow them to sleep better.
So napping's not always good.
Napping's not always good. Yeah, a question over here.
What happens neurologically? Like obviously you have common sense, right? You go to bed after a few nights. What happens like neurologically?
Yes. So let's talk about alcohol and sleep, right? So the #1 sleep aid in the world is alcohol. More people use alcohol to help them sleep than anything else, right? But there's a really big difference between going to bed and passing out, right? Right? We want to avoid the passing out side of things. But it's pretty interesting when we look at alcohol. So alcohol in particular only gets metabolized at certain points in time in your circadian cycle. So there's something that your liver produces which is called alcohol dehydrogenase. And this is what actually helps burn through the alcohol and helps your liver blow through and get rid of all the alcohol, okay? Guess what time it has a tendency to pop up?
2 to 3 a.m.
No? It's actually far more obvious. What's happy hour? Yep, about 4 o'clock or so till about 6 o'clock or so, that's when alcohol dehydrogenase has a tendency to really be produced quite heavily. And you know, bartenders for hundreds of years have figured this out. I don't think they knew about alcohol dehydrogenase, but they figured out that people could drink a lot during this period of time, and that's what they do. But when you go to bed and you have a lot of alcohol in your system, and by a lot, I'm thinking more than about 3 drinks or so, that's gonna have an effect on your deep sleep, that stage 3, 4 sleep, that physically restorative sleep. It almost knocks it out completely. That's why hangovers suck, right? Because you haven't had any deep sleep, and that lack of deep sleep hasn't allowed your body to have any physical restoration. The second half of a hangover is usually dehydration, right? Because once you start drinking and you go to the bathroom, you're going to the bathroom all night long, right? And so the long-winded answer to your question is, it's okay to have a couple of glasses of wine or beer or spirits with dinner. It takes the average human body approximately 1 hour to digest 1 alcoholic beverage. So what I do is I recommend a 3-hour window. So if I have a couple of glasses of wine and a scotch at the end of the meal, I need to have stopped roughly 3 hours before lights out, so that that way the alcohol has been metabolized through my system. I still enjoyed my meal, I still felt pretty good, and I didn't have rotten sleep over it. Make sense? Cool. So, interestingly enough, the last little tidbit on naps has to do with something that we see in Latin America all the time, which is the siesta. Exactly. It turns out that naps are actually biologically driven. So at night, your core body temperature is rising, 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 and then about 10:30, it hits a crest, and then it begins to fall. When it falls, that's a trigger to your brain to release something called melatonin. We're going to talk a bunch about melatonin in just a second, okay? Guess what? There's a similar core body temperature dip between 1 and 3 in the afternoon. So this is a biological thing. When you get tired between 1 and 3, how many people here get tired between 1 and 3 in the afternoon? I mean, I do, right? Here's the way to beat that, okay? Is if you know roughly when your time is to get tired, do yourself a favor, 10 minutes before that's about to occur, because it's usually pretty consistent, go outside and get direct sunlight. Sunlight, when it hits the eye, there are special cells in your eye called melanopsin cells, and they actually will turn off the melatonin faucet in your brain. So instead of getting a coffee break at 1 or 2 o'clock, get a sunshine break first and see how it goes. If it's really terrible, then take a napa latte during your 10-minute break, and you'll be, or 25-minute break, and you should be okay. Right? Make sense? So one of the questions that I get asked constantly is, Michael, can you take my 8 and bring it down to 5? And I still be healthy, right? I get asked this question all the time. So the truth of the matter is, it is possible. It's not healthy, but it is possible. So it's called polyphasic sleep, okay? And there have been people who've been figuring out these schedules all the time, but a siesta is an example of polyphasic sleep, right? So think about it kind of like this. If you had 6 core hours of sleep, and then you got 20 minutes of sleep, right? So let's say normally you sleep 7 hours, okay? And you want to reduce that down. If you got 6 core hours of sleep and you took a 20-minute nap, you'd remove roughly 40 minutes of sleep, right? The idea here is to continue doing this, but to have multiple naps and shortening that core amount of sleep. So then the next thing to do, I know it's crazy, right? 4.5 hours of sleep, and then you have 2 20-minute naps. The naps have to be specifically timed. One of them has to be at noon, the other has to be at 4 o'clock. But if you did that, where you had 4.5 hours of sleep, and you had 2 20-minute naps, you just knocked off 110 minutes out of 7 hours of sleep. That's kind of crazy, right? It's almost 2 hours of sleep you've knocked out. If you wanted to get super crazy, like Tim Ferriss, you guys have seen him, the 4-hour body and all that kind of stuff, he talks about this in there as well. He actually broke it down to a 3-hour core with 3 20-minute naps. And he removed almost 200 minutes from his total sleep cycle. Now, what's good or bad about this as an idea? Well, first of all, here's what I can tell you is I've worked with several clients who said to me, Michael, I want to do this. I'm going to do it without you. Please do it with me so I don't hurt myself. So I'm like, okay, I guess I got no choice here. So here's what ends up happening is if you have any proclivity for depression, it pops almost immediately by the 3rd week. So if you have any depression in your background, in your family, you will become severely depressed if you try this. I'm just warning you now. I've had this happen with 2 of my patients, and we had to actually, it wasn't good, right? The second thing is it's lonely. Think about it. Let's say you're only sleeping for 3 hours a night from midnight to 3 a.m. What are you going to do for the rest of the 21 hours of the day, right? Like, there's only so much internet that you can surf. There's only so many people that you can write an email to. There's only so much work you can do. It actually gets incredibly lonely and you become incredibly isolated. And that's part of what part of the problem is here. I have one friend who actually has successfully done this for almost 9 months now. And it's been pretty amazing because of the skills that he's picked up. So what he decided to do was learn musical instruments in his spare time. What he didn't do was pick the instruments correctly because he picked the drums. Really dumb. True story. And so he had to go down to the basement of his house. His wife eventually said, look, you need to pick up the guitar or something like that because we can't do this anymore. But he actually has been doing it for almost 9 months now. And he hasn't shown, but he has no background of depression. He's like, what, 6'1", he's about 180 pounds, so he's fairly lean. Like, he's a pretty healthy guy, eats pretty clean. He was able to figure it out and do it, but it's super individualized and it's not something I recommend, but it is something that I get asked about quite often. Let's talk about coffee. How many people in the room would tell me that coffee is the first liquid that passes over your lips in the morning? Raise your hands. That's it? Okay, how many people here just drink coffee during the day, period? Or some form of energy drink or caffeine? Okay, so that's a little bit different, right? So here's what's really interesting is when you're breathing at night, the humidity in your breath, you actually lose almost a full liter of water each night. You actually wake up dehydrated, which is why alcohol is even worse, because not only are you dehydrated from peeing from the alcohol, but then just the process of breathing makes it even worse. So you actually are very, very dehydrated. The best thing that you can do when you wake up in the morning is to drink about 16 ounces of water. With lemon or an alkaline water. These waters are actually great. I don't know if you've seen these high pH or mid pH waters. These are actually really effective and can be very good for you. But that's one of the first things you want to do. You don't want to drink coffee. Now, when should you drink that coffee? Well, it's really interesting. In order for your body to pull itself out of a state of unconsciousness, you need two hormones. You need cortisol and adrenaline. And if you compared caffeine to cortisol and adrenaline, it would be like comparing like weak tea to cocaine, okay? Like, those things are super duper powerful. When you throw coffee on top of that, it doesn't do any good. It doesn't do you any good. You don't get the pick-me-up that you're looking for. The reason that you're sleepy in the morning is not because your body has a lack of caffeine, right? It doesn't work that way. Caffeine's not a replacement for sleep. Wait 90 minutes. If you wait 90 minutes, your cortisol level actually begins to drop. And then when you drink caffeine, then it'll actually work with your cortisol and it'll actually pick up quite nicely. So if you're thinking about drinking caffeine in the mornings, which I'm not saying is necessarily a bad thing, you want to wait about 90 minutes. And there was a great study recently that showed that the aroma of caffeine alone was almost as alerting as drinking it. Yeah, so there are people now who are going to be creating these alarm clocks that actually have scent of caffeine, right, and mint and all these other things that are supposed to be very alerting. We'll have to see what happens. Your daughter gave you a bear? Oh, a stuffed bear. Okay. Oh, and it had a coffee smell. Yeah, and so when you smell it, does it make you feel alert? Yeah, it's pretty cool, right? So it's pretty awesome. So the question is that true for green tea? It depends on the amount of caffeine. Generally speaking, green tea's got L-theanine in it, which is really good for calming you down and keeping you kind of focused and straight. So I like green tea in the morning, but I don't drink it as the first thing. I'm 16 ounces of water, and then I'm taking supplements, and then I'm getting ready. Yeah?
How important is drinking water?
How important is drinking water? So it's kind of an interesting question. For sleep, there's a lot of evidence to show that a dehydrated body does not sleep as soundly or as deeply as a well-hydrated body. Now, there's a lot of controversy about how much water is enough. Is it eight glasses a day? Is that total BS? It's probably total BS. Here's what I would tell you is I can tell you that I can't all the time, but most of the time, if I'm watching somebody during a sleep study, you can start to see the ones who are dehydrated. Because the amplitude on the EEG isn't as high, their sleep is very fragmented, and usually one of the first things I do is I hydrate the heck out of people to see if it helps their sleep. Unfortunately, for some people, it makes them pee in the middle of the night. So it's kind of a balance that you have to take. Another good tip for you guys in the mornings is one of the first things you should do while you're drinking your water is walk over to the window and get 15 minutes of direct sunlight. Okay? So remember those melanopsin cells I was talking about in your eye? We want blue light in the morning because it turns off the melatonin faucet in our brain. We don't want blue light at night. Yes?
Should it be pitch black when you're sleeping?
So the question is, should it be pitch black when you're sleeping? I personally don't like it when I can't see my hand in front of my face type of thing. Everybody's different in kind of what they like or they don't like as far as amount of light in the evenings. And if you have a bed partner, sometimes they'll wear eye shades if they like it really, really dark. You don't have to have it pitch dark. Like you don't have to walk around with, electrical tape and put it on the, all the devices that are wandering around. That level of light is not going to make it really bad. I will tell you the worst light usually in the bedroom is the alarm clock, right? How many people in here wake up in the middle of the night? Well, first of all, how many people in here wake up in the middle of the night? Right? Okay. And do you ever make the mistake of looking at the clock? And then you instantly do the mental math, right? It's like 2:30 in the morning. Crap, I gotta get up in 4 hours. I am not feeling really good right now. I need to get some rest. And so what do? Sleep. Like you try to force yourself to sleep, which never works, by the way, right? Because you've created all this internal arousal in your body, so it's never gonna work, right? So it's honestly, first thing you do if you do wake up at 2 o'clock in the morning, turn the clock around. Don't look at the clock. Put the clock across the room. You don't need that piece of information. You don't need to know that it's 2:30. You really don't. I swear to you, you don't need to know that piece of information, right? So, yes?
Why are so many people wasting their beds when you ask a question who wakes up in the middle of the night?
Great. So that's a great question. Why are so many people waking up in the middle of the night? Is kind of what you're asking here. So there's a couple of different reasons that we think this occurs. So one of the things that I've recently found in about 30 to 40% of my patients is it's a blood sugar issue. So a lot of people, when I ask them, what time do you wake up in the middle of the night, they almost invariably say somewhere between 2:30 and 3:30 in the morning, right? So first of all, from a circadian rhythm perspective, we know that your circadian rhythms are actually crisscrossing about that time, and your core body temperature is actually starting to raise again, so you're gonna go into lighter sleep anyway during that little period of time. But when I ask people and I say, you wake up at 3:30 in the morning, I say, well, what time was your last meal? They almost invariably tell me 7 o'clock, right? Well, from 7 to 3:30 in the morning is 8.5 hours. You're out of fuel, right? Most people think that when you go to sleep, you actually put the car in park. Not even close. You actually probably put it in like third gear, right? Your brain uses as much glucose in REM sleep as it does during wake. If I showed you EEG waveforms of people in REM and people awake, you couldn't tell the difference. I couldn't tell the difference, right? You use so much glucose. So one of the tricks that I use, and it works about 30-35% of the time, is I have people eat a teaspoon of raw honey before bed. Teaspoon of raw honey. Now look, if you're diabetic, this is not a great idea, okay? I get that part. But a teaspoon of raw, and it has to be raw honey. You don't want the kind in the bear that's processed in the store, okay? Because it takes your body a lot more to get through, to metabolize through the raw, and it actually seems to keep your blood sugar stable longer. If you're not a sweets person, guava leaf tea, not guava juice, but guava leaf tea. There's one study to show that it actually helps keep blood sugar stable, drinking it before bed, and it's nice to have something to try before bed. It works out pretty well. Say again? Yeah, because in the middle of the night, your sugar has dumped. And what happens when you have no sugar is your body says, oh, I need to add some sugar, so it needs to create insulin. So what does it do? It jacks up your cortisol, and cortisol wakes you up. Yes?
So that's why I wake up and go to the cupboard and get some packages.
Yes, exactly right. So that's why when you wake up in the middle of the night, a lot of times you're hungry, right? So a lot of times I'm actually trying to get people to have a small 200 calorie, if you will, snack before bed, because it'll actually help push them through. And believe it or not, carbs are not the devil, okay? Carbs actually help you with sleep. They help with serotonin. Everybody needs carbohydrates in their diet on some level. Saving a couple of carbs for the end of the night is not going to hurt you. It's actually probably going to help you in your sleep. Next thing that you want to do during the day is staying fit. Oh, sorry.
Real quick, so
Anthony.
does that have any correlation with any of like the H4DC tests, the blood tests, or anything?
So the question was, has anybody done any blood tests to look at blood sugar throughout the night and things like that? I haven't done that work yet, but I'm about to start because I'm convinced, because literally 30 to 35%, maybe even 40% of my patients, I just say, take a teaspoon of honey if you wake up at 3 o'clock in the morning and tell me what happens, and it works. Actually, there was somebody here on staff here, right? Sean? Yeah, that I told him to do it, and he was like, it worked like a charm. So it's pretty interesting. Yes, this woman in the back. Sure. So the question is, how much is too much coffee, and when should you stop drinking coffee during the day? So the National Sleep Foundation said that you really shouldn't have more than about 200, 250 milligrams of caffeine in a day. Okay, now what does that equal? That's basically 2.5 cups, 6 ounce, 7 ounce cups of black coffee, right? So if you look at, so as an example, it used to be that Dunkin' Donuts had like the most caffeinated coffee out there, and now Starbucks, I think, is beating them. Like, believe it or not, if you look it up, if you Google it, you'll find that different coffee shops are really proud of their unbelievably, strong coffee. And by the way, the stronger the taste doesn't necessarily mean more caffeine. It turns out that the lighter the lighter coffees actually have more caffeine. You want to stop. Caffeine has a half-life of between 6 and 8 hours. So if you have problems falling asleep or staying asleep, what I recommend is you go decaf by around 2 p.m. 2 to 3 p.m. is usually kind of the good spot, because then around 10, you've got about half of it out of your system. You should be able to fall asleep. Yes?
I was going to the bathroom in the middle of the night at 5, so like, sometimes I go twice.
Uh-huh.
I need an hour more.
Gotcha. So the question is, how does going to the bathroom in the middle of the night affect our 5 cycles? So the good news is it really doesn't, but it's super disruptive. And so there's a couple of strategies that I have people employ if they do have a tendency to get up in the middle of the night. So the first one is do not, I repeat, do not turn on the light. Okay, because you just told your brain it's morning, it stops producing melatonin, and it's really hard to go back to sleep, right? Strategically place night lights along the way to the bathroom, get there, do what you need to do, come back. That's number one. Number 2, a lot of people wake up and think, well, I'm up, I might as well go. That's not necessarily the best idea either. I'm not saying if you gotta pee, don't pee. What I am saying though is when you go from a recumbent position to a sitting position to a standing position, you've just increased your heart rate. Most people don't know, but you actually have to have a heart rate of approximately 60 beats per minute or lower to go to sleep. Right? So you have, when you sit up and you stand up, guess what? Your heart rate just jacked up, and lo and behold, you're gonna have a hard time. The best thing that you can do to get back to sleep, which might be the next question, has to do with lowering your heart rate as quickly as possible. My favorite techniques are deep diaphragmatic breathing. So I'm personally a big fan of the 4-6-7 method. Have you guys heard of that before? Right, so you breathe in for a count of 4, you hold it for a count of 6, and you breathe out for a count of 7. If you do that about 5 or 6 times, you will absolutely lower your heart rate, and it'll make it much, much easier to get back to sleep. Staying physically active turns out to be one of the best things that you can do for sleep. The data is super duper consistent. 20 minutes of physical activity during the day will actually improve your sleep dramatically. And I'm not saying you don't have to run a marathon. Okay, 20 minutes, park your car far away, walk to work, walk the dog, whatever you need to do to get 20 minutes of some type of movement in the day is gonna be really, really good for you in general. Yes?
When you say naps and, it's 20 minutes per nap, that obviously, like when you go down and lie down,
Right, you want to give yourself a little bit of space beforehand. Yeah.
And for people that wake up early in the morning when there isn't light outside, what ways can we get some?
Right, so this is a great question. So, also don't let me forget, I want to talk about blue light at night while I'm talking about light in the morning. So if you need to get light in the morning, Amazon, it's called the Go Light, G-O-L-I-T-E. It's made by Philips. I have no representation by them. I don't make any money from it. It's a great light box. I bought one of these and I bring it with me when I travel because I can actually bring sunlight with me in a box and I can have my jet lag go to 0. So I just got back from a trip from Asia where I went to Singapore, Jakarta, Tokyo, and Shanghai, and I had 0 jet lag the entire way using caffeine, napping, melatonin, and light. Oh, and by the way, everybody should check this out for you guys tonight. If you go, there's an app that I did help create. It's called Time Shifter. So if you go to this website, timeshifter.com and you hit /the sleep doctor, you will get 2 free jet lag protocols. So you punch in where you're going, where you are, where you're going, and it'll actually give you an entire schedule and help reduce your jet lag to almost nothing. We actually tested it out on astronauts in the space station, and we've been using it with Formula One race car drivers who are all over the world all the time, and they have to be on point, and it works really, really well. Yes, sir?
We were talking about a photobiomodulation device you're using, right?
I was talking about what?
Photobiomodulation. The
Polyphasics? Oh, yeah, okay.
Okay, so what was the name of that one?
Oh, Golite, Golite by Philips. I think it's like $100.
And there's a couple other devices that are like intranasal, in-ear, or...
Yeah, okay, so he's asking questions about the light boxes and that there are different form factors. So there's one that you can put in your nose, there's one that you can put in your ear. So the data is not great on any of those. So the ear one, so there was this device that was out there that people wanted me to get involved with, and so I brought it to NASA to take, and it was the inner ear one, and there was no data that could support. And then did paleo and all that. Here's what I found is a lot of protein in the systems makes me very alert. So having a protein snack at night isn't necessarily going to be helpful. I honestly found a 200 to 250 calorie, 70% carb, 30% protein, or 30% fat would be a great snack to have. Again, 200 calories. So what is that? Maybe it's a bowl of non-sugar cereal, right? In some cases, it's a pint of Halo Top, right? You know, whatever it is for you. I mean, that would be too much, but whatever it is for you to get you there to have some carbohydrates in your system is definitely going to be helpful. Yes? Oh, you're first.
I heard something around 5 o'clock in the evening to do a sweet potato because it releases dopamine.
So I haven't seen any studies on that, but I do know that from a carbohydrate perspective, sweet potatoes and yams are some of the best things you can possibly have. So it wouldn't surprise me that wouldn't be healthy. I don't know about it releasing dopamine, to be honest with you. I haven't heard about that one. Yeah.
Are you going to talk at all about things specific to anxiety, so like GABA, binaural beats, like things like that?
Sure. What do you want to know?
Give me the answer.
Sure. So here's what I can, so the question had to do with anxiety and how does anxiety affect sleep in general, and then what might be some of the protocols or treatments for that? Would that suffice? Sure. So here's what I can tell you about insomnia, which is my area of specialty, right? There are doctors who specialize in apnea, narcolepsy, limb movements. My specialty is insomnia. I can treat it all, but my specialty is insomnia. 75% of insomnia is either anxiety or depression, period. The other 25% is a mixture of your environment or your medical condition or the medicines that you're currently taking. And that's how I evaluate it. I believe that insomnia in most cases is an anxiety issue. And so the goal here is because it's all about heart rate, right? Because if your heart rate is above 60, you can't get to sleep. And if you've got anxiety, your heart rate ain't above 60, right? So whatever we can do to lower that level of anxiety is going to be super duper helpful. So you mentioned a supplement called GABA. So there's a lot of, so inside your brain makes this stuff called GABA. And I call GABA the brakes of the brain, right? Because it really just slows everything down and helps you out. There's controversial data as to whether or not ingesting GABA is actually worthwhile because most of it gets eaten up in stomach acid and a lot of it doesn't end up getting to the brain. If you're looking at tinctures or sublinguals, then you probably have a little bit better shot of having it work. I can tell you that I've taken GABA before and definitely felt more calm after I've taken it. But again, there's a difference between being calm and being asleep. So remember, one of the ways that I think we need to think about sleep is something that should be happening to us naturally. And we just have to kind of get out of its way, right? I used to tell people all the time, sleep is a lot like love. The less you look for it, the more it shows up, right? Which is super true. The same holds true with sleep. I've got some people who are anxious about sleep, right? They have anxiety surrounding whether or not they can sleep, and that just snowballs for them. So that's why one of the most effective treatments for insomnia is something called cognitive behavioral therapy for insomnia. So that's something that I'm trained in. Many psychologists are, but historically, actually I was just talking about this with Dr. Shaw on our podcast, historically, that's not what the medical community does. Insomnia has always been what we call a door handle diagnosis, right? So I talked with you about my blood pressure, I talked with you about my diabetes, and as the doctor is walking out the door and has his hand on the door handle, hey, by the way, I can't sleep, right? So what ends up happening? They write a prescription. Now, let me tell you what I think about prescription medications and sleep. There absolutely, positively is a place for prescription medications for sleep in very particular situations. If you've got cancer, you get whatever you want, right? If you've got bipolar disorder, no problem. Schizophrenia, I get it. There are certain situations that make a lot of sense for pharmaceutical intervention. However, in the majority of cases that I see, very few people have what I call a broken sleeper, right? That switch in their head, right? There's some set of behaviors that's going on beforehand that's thwarting the ability for that person to go to sleep, right? Sometimes it's they can't turn off their brain. Actually, that's the most common complaint that I get, is that they can't turn off their brain. So I teach them distraction techniques of things to do before bed to help turn off their brain. So here's a simple one. It sounds ridiculous, but I promise you that it works. I have people count backwards from 300 by threes. So we're all gonna try that together. You ready? So we're gonna start at 300, we're gonna go backwards by threes. Ready? 300, 297, 294, 291. Here's the tough one. So you paused on that one, right? So, okay, you can stop. So why is this effective? It's mathematically so complicated, you can't think of anything else, and it's so doggone boring, you're out like a light. Okay? And it works. Sometimes you have to distract your brain from becoming anxious because that's going to prevent your ability to fall asleep, right? I believe that anxiety has a significant root in all of this. Again, are there pharmaceutical interventions that work and work well? There are. But again, Dr. Shaw and I were talking about this. The thing that I dislike the most about what happens in the medical community, of which I am a part, is I give you that prescription, but I don't tell you what to do next, right? It's this pill without a program, right? And that's the problem, because nobody knows what to do other than you take the pill, you go to sleep, you wake up the next day, you feel halfway decent, you take the pill, and then 30 days go by and there's no more prescription, or 60 days or 90 days. I believe that we should be using pharmaceuticals to break the cycle of insomnia. And while we're breaking the cycle, somebody like me comes in and teaches people how to sleep, and then we slowly taper people off of the drug. It takes about 3.5 to 4 months, but it's very, very effective if you get the right practitioner who's willing to do something like that with you. And I've had great success with that. Yes, sir?
What does something like that cost for 3 to 4 months?
What is, I'm sorry, what was the question?
Like, what is the cost, like a 3 to 4
Oh, the cost of like something like that. So it's going to be different depending upon the type of practitioner you go to and things like that. I can tell you what I am. I'm completely private practice. I don't take insurance. I'm $500 an hour. And I usually get people done in between 6 and 7 sessions. So, and I can usually tell by the 3rd session if it's going to work or it's not. And if it's not going to work, I'm going to say it's not working. We need to go someplace else, or I need to send you to somebody else. But that's usually how it works with me. But the more militant people are about listening to my recommendations, the faster it works. But it's not easy. And I'll tell you this, it's not fun. I use a technique called sleep restriction. So this is bizarre. And we'll just open it up for questions now. But this is, sleep restriction is a technique that we use with people with insomnia, where we actually ask them to stay up later, not go to bed earlier, which seems completely counterintuitive, right? Like, you're telling an insomniac to stay up later? You bet. Because here's what I'm going to do is I'm going to get you really sleep deprived, then I'm going to have you wake up even earlier than you normally do, take no naps during the day. You see where I'm going with this, right? And I build that drive, because I want that to work for me. Because if you've been taking sleep meds for 2 years, 5 years, 10 years, 15 years, your brain isn't really producing a whole lot of drive. So I got to restoke that fire and get that going again. Sometimes, some people it takes longer than others. Some people it only takes 5 or 6 weeks. Some people it takes 5, 6 months. It just depends. Yes?
Why shouldn't I just take sleep meds?
Why shouldn't you just take sleep meds? It's a great question. Yeah. So the long-term effects of sleeping pills as we see them now is you're really walking down a path of high likelihood of Alzheimer's and dementia, right? So it's actually even worse for the over-the-counter stuff, depending upon what you're getting. So there was a study that came out looking at, so Sominex, by the way, is just Benadryl, right? So, and that's what all the PM medications are, by the way. It's an analgesic plus Benadryl. So you guys familiar with a website called WebMD?
Yeah.
Right, so I was the sleep expert for WebMD for 15 years. And way back in the day, they had these things called message boards. Remember those message boards? And people would send me questions, and I was the guy that was typing like crazy in the back. And I would get a question once a month: is it okay to take a box of Benadryl a night?
No.
18 10 milligram tabs. Because here's what happens with the OTCs is they work for a little while because they give you kind of fuzzy drug head. They don't make you sleepy. They give you fuzzy drug head, and then you fall asleep, but then your body acclimates to it, and then instead of needing 1, you need 2, and instead of 2, you need 4, instead of 4, you need 8, and you're taking a fistful of Benadryl at night. But let's say that's not your situation. Let's say you got a prescription for Ambien, 5 milligrams, it works for you and it's working well, and you've been using it for 3 years with no repercussions whatsoever. I don't think I care. I don't think it's bad. It's working. You're sleeping, right? The question becomes, do you become uncomfortable being on the medication? Because if you do, I'm here to help you, right? Or if you say to me, well, I'm in a time in my life where it's super stressful and this is just what I need, I might agree with you. 90% of the patients that I see come to me on drug. 90%. And most of them, it's no less than 8 to 10 years on drug. Okay? So some people just get really uncomfortable with the idea that they have to take a pill to sleep every night, because when they don't have the pill, they really can't sleep. So there's a lot of pros and cons in either direction, but I don't think there is anything wrong with taking sleeping medication. If it's effective, if you're using the correct dose, and you're abiding by your doctor's rules and guidelines, it's probably very safe. Question?
And then we should wrap it up.
Oh, sure.
One question that I want to have is CBD. What's your thoughts on that?
Great question. So the question is about CBD, and we should also talk about cannabis as well, and sort of how does that work with sleep. So I am a fan, okay? The data is actually really interesting. So unfortunately, the data on THC and CBD has actually been, most of it has been done outside of the United States because of our stupid laws that say we can't do research and learn more about this stuff. But fortunately now that those barriers are being broken down, we're gonna learn more about it. But I can tell you that CBD for sleep probably works, especially in the pain syndrome people, like people with fibromyalgia, chronic fatigue, people with low back pain. All of those instances could be, CBD could be, what's the question?
I've been on APM forever. Can you recommend a CBD? I've never done it, but...
I can afterwards, I'll get with you and we'll come up with something for you for sure. But I'm a fan of it, but here's what's really interesting is CBD by itself, while it might be somewhat effective, there's some data to show that THC actually helps accelerate that. And also, by the way, there's nothing wrong necessarily with THC. Okay, we're in the state that allows us to all walk, over to MedMen or whatever, right? MedMen, right? And go over there and buy whatever we want, right? So the question then becomes, well, what should I buy? So I actually bring patients to the dispensary sometimes and help them choose what's going to be good for them. Believe it or not, there are now little vape pens that have metered dosages that are specific for sleep. And here's why I like that, is because historically, if you were smoking a joint and you took a hit and I took a hit, well, those were two completely different amounts of information that's going into my body, right? But if it's a metered dose, then everybody knows exactly what they're doing. It's like a prescription, right? It makes more sense that way. If you're looking for, and I'll take one more question. If you're looking for CBD or THC, the one thing you do want to remember, if you're looking at sleep, you really want to stay more on the indica side as opposed to the sativa side, because the indica side is a lot more relaxing, and the sativa side is a little bit more energy promoting. But by the way, everything out there is a hybrid. It's almost impossible to get 100% indica or 100% CBD on anything. I want to take somebody's question who hasn't asked a question yet. Yes?
Indications for sleep studies, getting sleep studies, and what kind of information
Mm-hmm.
you gain from that?
Sure. So the question is, what are the indications for having a sleep study, and then what type of information would we glean from that? Sleep studies, generally speaking, these days are primarily for apnea, narcolepsy, or what's called restless legs or periodic limb movements. We almost never do sleep studies on people with insomnia, because the process of going to have a sleep study done, if you go to a laboratory, is there's 27 electrodes that are put all over your body. There's these big things that go across here. There's stuff attached to your legs. If you didn't sleep well before, you're really not going to sleep well in the sleep study, right? So I never do sleep studies for my insomnia patients, but if I've got somebody I will tell you though, on occasion I've done sleep studies with insomnia patients only from the standpoint of we couldn't figure out what was going on. It was just purely exploratory, because sometimes they might have had a really mild version of apnea, which could have been kicking off insomnia. By the way, a lot of women present to sleep clinics with insomnia, and about 1/3 of them actually have sleep apnea. And by the way, it's not the apnea that they snore. So most people think of sleep apnea, you think of a big guy with a thick neck and snoring all the time, and and he's choking and gasping and all that stuff. There are people who are much leaner who have no neck, none of the obvious signs and symptoms, and they've got rip-roaring sleep apnea. The sleep study itself is diagnostic. Believe it or not, there are 88 different sleep disorders out there. It's kind of a miracle that you could do 88 things wrong in your sleep, but it is possible that you do. And so usually a physician is ordering a sleep study primarily these days to look for apnea or narcolepsy. Those are the two biggies. Almost everything else you can do through clinical interview and kind of understand a lot with that. So with that, I wanted to say thank you guys very much. I will be sticking around, and I will answer private questions as well.
Amazing. Thank you so much for coming out. You're a wealth of knowledge. Thank you guys all for coming out and watching, listening. We do have another talk series coming up on the 19th with Jim Quick, who is a brain and memory genius and expert that I highly recommend you guys check that out as well. RSVP in advance.
I would tell you that Jim's a personal friend of mine, and he's amazing. If you want to, I've taken his speed reading courses. They're really, really good. You should, if you have the opportunity to come and check it out, definitely come. Jim's awesome.
He's incredible. Thank you guys all so much.
No, yeah, you're good.
What are you